see that.
You can start up.
Yeah, but yeah, I'll start. Okay, good morning, everyone. I'm Dr. Ashi Suresh. So today we are going to discuss the topic Mallampatti classification. So before getting into the topic proper, let's just observe this diagram, right? So it shows a patient who is lying down and a doctor who is doing laryngoscopy. So laryngoscopy is done for intubating the patient. So what does intubation means? That an endotracheal tube is introduced into the patient's trachea. So as you can see, the doctor is holding the laryngoscope, this one, with his left hand, and the endotracheal tube with his right hand. You can see this is a shaft of the laryngoscope and this is the blade of the laryngoscope. The blade of the laryngoscope is pushing the tongue out of the way so that now the doctor is able to see the oral structures clearly, and through the oral cavity he can now see the larynx and vocal cords. And so once you see the vocal cords, you know that the endotracheal tube will enter the trachea, right? So you have to pass the endotracheal tubes into the trachea. So now it's clear that you have to get the tongue out of the way with the blade of the laryngoscope for an intubation. So why is Mallampatti classification important? So Mallampatti classification is used as a predictor to predict a difficult airway, which will in turn lead to a difficult intubation based on the size of the tongue or the relation of the tongue size to the oropharyngeal structures. We'll talk more about it. So it was discovered by Dr. Shagri Mallampatti in 1980, certified by Samson and Young in 1987, and to 4 classes, and 1998 the class 0 was added. So now it has 5 classes: 0, 1, 2, 3, 4, and 3 and 4. Right. So now first let's get the anatomy of what we are looking at. Right. So the indication of Mallampatti, it's done in every patient before we take them up for surgery in the pre-anesthetic room. So what our aim is to determine whether this patient, or we will have difficulty intubating this patient once we have put him under anesthesia or unconscious, right? So if we get a predictor earlier that this patient is going to be difficult to intubate, that is, the patient is having difficult airway, we can make the necessary arrangements for more specialized and advanced equipments as well as drugs to secure the airway successfully. So now you can see, so the procedure is the patient sits neutrally upright opposite the examiner. We ask the patient to open the mouth and protrude the tongue as far as possible, open the mouth as wide as possible with no phonation. That is, patient should not say ah and all. No sound should come. So now you can see a patient who has opened his mouth with protruded tongue, right? So what all are you looking for? What all do you need to see to classify this patient? So here you can see the anatomy. You can see the hard palate, soft palate, uvula with the tip of uvula, and these are the tonsillar pillars. This is the tongue and base of the tongue. And this space, right, the oropharyngeal space that you see here, that is called as the oral fauces. Right. So these are the structures you are trying to visualize while you are eliciting a Mallampatti score. So now the patient is opening, and now we can see the real patient. You can identify the hard palate, the soft palate, the uvula, but the tip of the uvula is not seen here. Then you can see the pillars. These are the pillars, and the small dark space, right? So basically the fauces is a space behind the tongue, in the oropharynx. So the fauces you can see, and then the tongue. So now you know that what you are expecting to see when the patient opens her mouth. Now let's see how we can classify this patient. So in the first class, so we have said there is class 0, discuss 1, 2, 3, 4. So in the first class, you can see the tip of the uvula, the soft palate, hard palate, pillars, oral fauces, and of course the tongue. So this class 1 means you can see, you can hear me, right? Yeah.
Yes.
Yeah. So class 1 is pillar, uvula, soft palate. You can see everything. Uvula, the tip to uvula, and the fauces, soft palate as well as palate. Class 2, you can now see the tip of the uvula is no longer seen, and you cannot see the pillars. So it's the oral fauces. And then in the third, you can see that all you can see is the soft palate, hard palate, of course, soft palate, and a little bit of uvula. That is the base of uvula. So mainly you can only see now the soft palate, right? And a bit of base of uvula. And in class 4, you cannot even see the soft palate. You can only see the hard palate. So basically, an easier way to do this simple acronym is there. So you have PUS, that is pillar, uvula with tip, and soft palate in class 1. AS, that is uvula without tip, and soft palate is visualized just the S. So PUS, PUS, US, S is just the soft palate with maybe the base of uvula, and in class 4, not even the soft palate is seen. Right. So we'll once again go through the classification. So again, I've said there are 5 classes. So class 0 is as soon as a patient opens a mouth, you see the epiglottis itself. That means you can see well into the larynx, and you are seeing the epiglottis which is covering the larynx. So you have class 1 is pillar, uvula with tip and soft palate. Class 2, uvula, soft palate. Class 3 is soft palate with base of uvula, and class 4 is soft palate. Even soft palate is not visible. So just the hard palate is visible. And class 3 and 4 are classified as difficult airway. That is, it is predicting that once you observe the patient in the OPD and you see a class, you can just only see soft palate. That means that when you try to intubate the patient subsequently during surgery, before surgery, you will have difficulty in intubate. So it's a small predictor of difficult mask ventilation with the face mask. But mainly it is used for difficult intubation and difficult laryngoscopy. So, mask ventilation, and also alone the Mallampatti score alone in itself is not a good reliable predictor. If you combine it with other airway assessment scores, you will get a better sensitivity. That is, you have better chance of actually identifying a difficult airway. Again, why should not, you have said that the patient should not say and, or why should not the patient phonate when he opens his mouth? Because of phonation, you can see yourself, if you try looking in the mirror, that it will raise the soft palate and you will suddenly get a better view of structures. So a patient may be Mallampatti 2, and if you ask him to phonate Mallampatti 3, and if you ask him to phonate, he might turn into Mallampatti 2, because now you can see the and then supine position. So patient is sitting, right? So supine position will give a higher Mallampatti score. And again, one another point is increases during pregnancy. So what does that mean? That means that in the first trimester, you see the patient good airway, right? And if you go with that conclusion, and in the third trimester, there's a cesarean section, you're suddenly trying to intubate the patient, you see that its score has changed, is very difficult. So this is because Mallampatti score may increase during the course of pregnancy, because pregnancy stage there's fluid retention, especially in the soft in the tongue as well as the surrounding soft tissue. So if the tongue gets bigger, you can see in this picture, if the tongue is getting bigger, that means that the score may go higher, right, from 2 to 3. So it's always in pregnancy, you should be very careful to re-examine the patient just before taking her up for surgery. So that is the basic points. Now let's see. So can you identify the Mallampatti class of this patient? So 0, definitely you're not seeing any epiglottis. So 0, 1, 2, 3, 4. So no epiglottis, not 0. Then you have PUS, US, S, and nothing. So can you see the pillars? No. You can see the uvula. Yes, you can see the soft palate. So it is Mallampatti class 2. So what is Mallampatti score used for? A. Mobility of the cervical spine for ease of intubation. B. Mobility of atlanto-occipital joint for ease of intubation. To assess the two oropharyngeal structures for ease of intubation. Of course, we are looking, these are all other scores. So we are looking for, we assess the relationship of base of tongue or the size of the oropharyngeal, visualization of oropharyngeal structures. So the answer is B. Last question. A 48-year-old male is admitted for laparoscopic cholecystectomy. The image below shows his airway findings while eliciting the Mallampatti score. Which of the following statements is true? So first we look at the image, right? Epiglottis is seen, no. Then you have pus. Pillars are seen, no. Uvula is seen, no. Hard palate is seen, no. So that is Mallampatti 4. So 4 means that Mallampatti class 4 is a difficult airway. So we have established that this is a difficult airway. Now we'll look at the options. The soft palate is seen, hence it's not a difficult airway. So here the soft palate is not seen. So that is not right. Endotracheal intubation can be achieved with ease in this patient? No, because it's a difficult airway. Again, no. The patient is Mallampatti class 3. No, we have ascertained that the patient is class 4 because even the soft palate is not seen. Only the hard palate is seen. Right. So again, that is also wrong. Only the hard palate is seen. Hence, it's a difficult airway. So this is the option is D. Right option. Thank you. Hello?
Yes, ma'am.
Yeah.